So this is our first ever Plant Medicine Expo and Healthcare Provider Conference.
First of many to come.
First of many to come, and the idea is to set the example, to allow people to come together in an environment where they're comfortable. And you know, we have a great conversation coming up later, of panelists debating the issues that are in front of the State House and federal issues. And
You probably know this, the Constitution is written on hemp. The first flag is made out of hemp. The parachute that George Bush jumped out of an airplane, it saved his life in World War II, George Bush Sr., was made out of hemp.
So Bells, how has medical marijuana and the use of it affected people in your life?
Friends, people in my family, personally, I've seen incredible benefits to it. And you know, I had my doctor when I was being radiated for my cancer say, you know, you should use marijuana, and you know, he couldn't prescribe it, and it was kind of like, you know, speakeasy time.
I'm going to tell them to be objective and to look at studies of patients, real people who have taken this, and ask them what their alternatives were. And I know the answer to the question because I've seen people in wheelchairs here who were on some real terrible, serious medicine, and now they're functional and much happier.
But in general, one dropper full of medicine is a pretty effective dose. Some people that are extremely sensitive to cannabis might be better served with doing drop doses, which means, you know, like 1, 2, 3, 4, 5 drops.
Right, and just to be clear, these do not go in your eye.
No, not in your eye.
Do not put these drops in your eye.
Diego.
So if a veteran has an alcohol problem, a cocaine problem, an opiate problem, they could go to the VA clinic and get into a treatment program, but they could still use their cannabis, except one glitch. They could use it if it's an outpatient program. Because the VA system is a federal system, the veterans can't have it on VA property.
Join me in welcoming Richard Belzer.
So rather than go on and on with this highly positive review, let's just start right here, sir.
Right. This is an issue of states' rights. The people of Colorado have passed Amendment 20. It's in the Constitution. Whether we like it or not, that's the law of Colorado.
Right.
And we need to do everything we can to protect that law and to prevent the federal enforcement of it from undercutting the will of people.
What I would say to someone considering getting into the medical marijuana industry is, first and foremost, recognize change. Have the ability to adapt, adjust, and change with the marketplace. Also, the demographic that we've attracted is not the 21 to 28-year-olds, it's the 35 to 65-year-olds with expendable income that are seeing this as a legitimate and viable industry.
What I'm seeing and what I think is being demonstrated here is that innovation and capitalism is driving this industry, and companies like this one, which are based in Montreal in Canada, have developed these very high output, high efficiency tools or pieces of machinery.
Patient that really doesn't want to have carcinogenic smoke in their lungs. This is another delivery method for cannabis. Here we have a different range of books explaining cannabis.
I'm Amy with Grow Magazine and Cannabis Connoisseur. We have 2 magazines here. This one is more content focused, and this is more photography and eye candy of bud focused. We have all these wonderful pictures of all these different kinds of medication and what ailments they're focused on. And then in Grow, we have a lot of educational information on growing, legalities, culture, and just a broad spectrum of cannabis culture.
Yes,
And
you're
this
going to
is
put the
for
hash
more
oil
the
in this part.
vegetative,
Exactly, that's the more
the
vegetative.
shake.
That's going to be basically a handheld vaporizer.
Wow, amazing.